Hello, everybody. This is Dr. Kamel again, and a new content relating to physical therapy education and preparation for the PT license exam. Okay, if you don't know me, my name is Dr. Kamel. I work as associate professor of physical therapy in United States, and I'm a registered licensed physical therapist in United States, Egypt, and in the UK. So, what is today content? Today's content. Today's content is about uh, integumentary, and we get some questions about integumentary relating to classification of wounds, relating to classification of different ulcers, different types of ulcers, neuropathic ulcers, the diabetic ulcers, um, you know, arterial, venous, and so on. And sometimes we get questions about dressing. We have different types of dressings. We have different amounts of fluids coming out of each type of wound. So let's go and see what's today's content. Upon removal of a wet to dry dressing from a patient's draining wound, physical therapist observes that the skin immediately surrounding the wound is macerated. What is the meaning of that? Let's imagine that this is a wound. Okay, this is a wound area, and this area around is called the berry wound, the surrounding area around the wound. You have applied some dressing, wet to dry, and you left it until it dried and you removed it. And unfortunately, sometimes when you remove this dressing, the berry wound area, what will happen sometimes, being damaged, or the dressing will take this healing tissues out. But here the issue is different. The berry wound area was macerated, and maceration is a sign of too much fluid sometimes. Okay, we need to keep the wound moist in order to have proper healing, but not too much moisture and not being dry at the same time. So, what should the therapist recommend for future wound care? Either continue using the current dressing type. It might be that the current dressing type is not absorbing enough fluid. Make the dressing more absorbent? Maybe this could be the answer. Leave the dressing on longer between dressing changes. This will not solve the problem. If the dressing cannot absorb enough fluid, this will not solve the problem. Change to a pressure type dressing? I don't think so. So the correct answer is make the dressing more absorbent. Maceration of the very wound skin, which, as I described, occurs when the skin is exposed to excess moisture for a prolonged period. In this case, the wet to dry dressing is allowing too much wound exudate to remain in contact with the surrounding skin, did not absorb this fluid or wound exudate, leading to tissue breakdown and increased risk of infection. So, how we can manage maceration? The primary goal is to control moisture, which is this is a primary goal, and at the same time, we need to manage, wound drainage. It might be that the dressing which we are using is not enough, and we need to change it to another type. So, the more absorbent dressings, including foam, alginate, hydrofiber dressing. We explain all these types of dressing in our course, and we give examples, pictures, and stuff about it. The advantage, disadvantage. These types of dressing can better handle moderate to heavy drainage. They reduce the moisture exposure to the surrounding skin. They protect the peri-wound area and promote a healthier wound environment. We need to keep the wound moist, absorb as much wound exudate as much as we can, avoid infection. So Again, macerated tissues result from excessive moisture. So we are in need to have a more absorbent dressing, which would soak up the excessive moisture and prevent the maceration. Let's look at the incorrect answers. Continue using the current dressing type. It is not working. Why I would continue to use the same current dressing type? The current dressing is already causing maceration. So continuing it would worsen skin breakdown. It is not a solution. Leave the dressing on longer between dressing changes. Again, this will increase moisture exposure for the peri-wound area, more skin breakdown, further maceration. This will make the situation. Pressure dressing are, changed to a pressure type dressing. Dressings are used for bleeding control or edema, not moisture management. Okay, and it might actually impair tissue perfusion or blood supply to the wound area, and this will impair healing. So again, maceration means too much moisture, increase absorbency. This is the solution, not increasing time, not applying pressure. If you are interested in joining my physical therapy license exam preparation course, or you want to apply for the transitional DBT at University of Montana in the US, United States, please send me a WhatsApp message to the following numbers: 001442248726 or 00201027743702, and I will reply to you as soon as I can with the details required, with the cost and arrangement for you to be a very successful physical therapist in the future. Okay, thank you for following me. Please subscribe to the channel and talk to your colleagues about the channel, which will be much appreciated. And see you soon in a new content.